Hello everyone, thank you for joining our live video. Today is our third anniversary celebration. So we just wanted to share our celebrations with everyone. This is our cake which Dr. Diksha has just arranged and we have just cut. And it's been a fantastic 3 years. Last year in particular has been quite challenging because of COVID, but we've been able to get through it. We've been able to help our patients properly, and at the same time, we've been able to grow and start doing new things. And now we have a couple of guests over here. First is Dr. Venkat, my father. So, one clarification people were asking me is how is it the third anniversary? Didn't it start much earlier than that? Well, Venkat Charmalya, started by my father, was in 2003. So it's 18 years for that. Venkat Center, which is what we became, and when plastic surgery was added, that it's the third anniversary of that one. So that is the celebration that we're doing right now. Whereas the actual Venkat Charmalya itself started almost 18 years ago. So how does it feel to be 18 years in private practice and seeing your practice grow like this?
18 years have been great. It has been a very rewarding and cherishable experience, satisfying experience, because we have grown, we have treated patients of all times, we have helped poor patients also through our Shraddha Clinic, and we have encouraged new talent, we have trained lots of doctors from everywhere, and personally it is satisfying to see the next gen in our family, you and Diksha, taking over and then starting a very promising run, what hopefully will be a very rewarding and successful growth henceforth.
And as you know, we've also started new technologies in the center. Where do you see us going ahead?
See, our motto has always been that while we will do certain things with great expertise, we should diversify and we should keep abreast of the latest needs of the society as well as latest developments in technology. Both are very important. So, while we started off with dermatology, lasers, then hair transplantation, then liposuction, now we have grown more strongly into aesthetics, skin tightening, then different plastic surgery procedures after you came, nanofat transfer, and then now with Dr. Diksha, ENT head and neck surgeon, starting her allergy clinic, then snoring clinic with lasers, and then branching off into cosmetic gynecology with Dr. Jayashri, starting her lasers for stress incontinence, lasers for intimate rejuvenation, and hopefully we'll further develop into newer aspects like lasers for vascular changes and other ancillary related plastic surgery, cosmetic surgery procedures. And importantly, we need to keep in mind our social responsibilities. So we will continue to run our Shraddha clinic for poor patients, Shweta clinic for vitiligo patients, and also our clinic for burns patients to help them of burns of all types, scars of all types, and we will also develop into newer location with a larger space and accommodation, and which can give more comfort and care to patients.
And finally, how challenging was COVID in the last year? I guess you've not seen anything like that during your career.
COVID has been challenging in different ways. One, of course, at the personal level, like any other person, and then at the same time sustaining the practice with online consultation. Fortunately, we have been fairly good in using technology for our benefit. We have been using online consultation for a very long time. So that change was not difficult at all for us. But what helped us also was our ability to adapt. We have published a number of publications and various innovations for performing procedures safely under COVID circumstances, which have been published. And so that is one development that we did. And at the same time, taking precautions, we cater to all the needs of the patients as allowed by the government regulations. So yes, it was a challenge. It was also a challenge in terms of sustaining the institute, providing succour and salaries to the staff. But we managed to do it, and we have passed through that difficult phase. Now we are looking up, and hopefully there will not be a third phase, and we will continue to do it well.
Thank you very much. And now the chief guest of honor, my wife, Dr. Diksha. Hi Diksha. आपको कैसा लग रहा है इधर 3 साल से काम करके?
Why are you talking to me in Hindi? Yeah, it was a good experience. I mean, I had no idea about private practice before I joined you guys, so I learned a lot in the last 3 years. And I would say that I have done okay, and I hope to do better.
And Dr. Diksha is waiting to eat her samosa and cake.
Yeah.
So it's been quite a fantastic last 3 years. So now I'm just going to take you through our facility. So as you can see, this is our consultation room, and it's also where we film our YouTube videos. Those who watch our YouTube videos, this background will be very familiar to them. And coming through, we go through the reception area. These are our fellowship doctors. Hello to everyone. We have a cosmetic dermatology training fellowship where we get doctors from all over India. And further going through, we have a staff who don't want to be on camera but are going to be on camera. ಕೇಕಿಗೆಲ್ಲ ತಗೊಂಡ್ರಾ? ಈ 3 ವರ್ಷದಿಂದ ಕೆಲಸ ಮಾಡಿ ಹೇಗೆ ಅನಿಸ್ತಾ ಇದೆ? So these are actually our senior most nurses. They have been with us almost from the very beginning. ನೀವು ಜಾಯ್ನ್ ಆಗಿ ಎಷ್ಟು ವರ್ಷ ಆಗಿದೆ ಈಗ? ಜೋಸ್ವಿನ್ ನಿಮಗೆ 20 years. So we would not be where we are without them, and they are literally the backbone of everything that we do. Thank you, sister. ಇದು ಪ್ರೇಮ ಎಲ್ಲೋದ್ರು? ಪ್ರೇಮ ಇಲ್ಲಿದ್ರಲ್ವಾ? ಆಯ್ತು ನೋಡಿ. So then coming through, this is our patient room where our patients recover after their procedure. They enjoy watching television. We have our doctor's room. We in fact just finished a surgery today. We had a hair transplant today. And here we have our minor OT and dressing room where we do small procedures. We have our photography background. Proper photos are essential when it comes to plastic surgery. It's important that people see real results and not doctored images. And moving forward, we go into the operation theatre complex. This is our hair transplant OT, where we have just finished a case today. We did an FUT. That is our general anesthesia workstation, which is something that we've added recently. So now we started doing general anesthesia procedures, daycare procedures in-house. This enables us to keep our costs down and help out our patients that way. Our patients watch the television while they're undergoing hair transplant. And then coming into the other plastic surgery OT, this is where we do our general anesthesia procedures and our bigger surgeries. This is our InMode device, which is something that we've added over the last few months, and it's something that's really quite revolutionary in terms of skin tightening, in terms of tightening areas of the face, face tight, body tight, and I think we have done a lot of videos on those, so do feel free to check it out. Now, over the last 3 years, we've done a wide variety of procedures. I mean, literally everything from the head to the toe. And it is one of my favorite parts of my job as a plastic surgeon that there is such a wide variety of procedures that is available. And it keeps you on your toes. There is every single case is different. Every single case is a mix of art and science. It's not a one size fits all. So each patient has to be treated with respect. Each patient has to be evaluated, and a custom plan has to be made for each patient. And that's one of the most satisfying, at the same time challenging parts of this job. So I just wanted to take you through some of the things that we've done in the past 1 year. This is just a small snapshot. So if you look at fat grafting, we had, so we did fat grafting for nasolabial folds. One second, this is just glitching a little bit. Hold on. All right, yeah, I think I've got it now. So just a few snapshots of procedures that we did. Fat grafting, you can see the improvement in the nasolabial fold. It can improve the aesthetics of the face, fuller cheeks, more prominent chin. Fat grafting we also do for treating various scars and deformities. And one of the most common reasons why we do fat grafting is for dark circles. Scars can be improved to a great deal with fat grafting and nanofat. You can see the massive improvement in this patient. Rhinoplasty, my absolute favorite surgery. So you can see here, nice sharper nose, hugely deviated nose, which we straightened, a wide nose, which we improved. One important thing in rhinoplasty in Indian patients is you have to tailor your techniques for Indian patients. You can't do the same things that they do in the West. So for example, this kind of very thick skin patient, getting this kind of tip sharpness is something that cannot be done with regular techniques. The techniques have to be adapted for Indian patients. Correction of hump nose. This was a secondary patient who had a surgery done elsewhere and we had to correct it. And non-surgical rhinoplasty, using fillers to get the result you want. Gynecomastia treatment. This is a huge problem for lots of young men. And here you can see the use of our body tight technology, the InMode, where you can shrink skin without giving a large scar. So this is what we have done here. All that extra skin has shrunk. This is a severe unilateral one, again, which we reduced without removing any skin, without giving any bad scars. He was a wrestler by occupation, and the gynecomastia was really affecting him. So there are so many such stories which are very, very gratifying. Liposuction with buttock augmentation. Liposuction is one of the most common things that we do. It is we do it under local anesthesia, which is why a lot of people come to us. So it's a much simpler procedure. A daycare case, they go back the same day. We also do high def liposuction the same way. Six-pack creation, arm liposuction to take care of sagging arms, double chin liposuction, tummy tucks for postpartum ladies with a lot of extra skin, giving them their body back, giving them their confidence back. Fillers and Botox, another thing that I really enjoy doing. There's so much nuance to it, so much tiny improvements that you can give that can all add up. Here you can see a lady with eye bags. We have improved the appearance with just fillers, 10-minute job. And other procedures like lip reduction, blepharoplasty, double eyelid creation, otoplasty. Breast reduction, one of my favorite surgeries. I'm in fact doing one tomorrow. So these ladies often have severe neck pain, back pain, carrying all that weight, and the surgery is very gratifying for them. Breast augmentation with fat grafting, silicone implants, and of course hair transplantation, which is something that my father started and which we are taking forward now. Hair transplant, right now there are so many people doing it, not always in the best way. So make sure you do your homework. So that was just a small snapshot of what we have done over the past 1 year. And as I said, it's been a very gratifying ride. The last 1 year has been challenging with the COVID pandemic. There were obviously times when we could not operate. Cosmetic surgery was not the important thing on everyone's mind at the height of the pandemic. So at that time, we were able to just be there for our patients. We did online consultations for people with COVID. And then now, thankfully, now that the second wave is died down, we are in a better position and things are coming back to normal. In fact, we're seeing a lot of people who have always wanted to undergo a procedure but couldn't because of various reasons. Now, post-COVID, they want to kind of like do something for themselves and feel better about themselves. So we're seeing a lot of patients come in that sense, and that is very gratifying to see. And at the same time, our motto has always been expertise, experience, ethics. What I mean by that is it's not just about what we can do, it's about what we should do. So we always tell our patients the full information, give them all the information they need to make their decision. Nothing is ever forced, nothing is ever prodded, and we would never advise anything that's not in their best interests. And any medical procedure anywhere can have complications. And if and when such things do happen, we're always there for our patients, and that is the basis of everything that we do. So it has been a fun 3 years. Look forward to many more. We have many more interesting things in the pipeline that we are planning to expand on, and we will keep you posted. Doing social media, YouTube, Instagram, it has been a very gratifying experience. Initially, when I first started, I was a little hesitant in the sense that I was not sure how it would be taken. But I've had many patients come and tell me that because of social media, they've been able to understand things a lot better. They feel a lot better informed. And once I heard that, it really reinforced that, okay, this is a very good way to empower people and give them proper guidance and information rather than getting some half-baked knowledge, because there's a lot of half-baked knowledge available on the internet. So as a medical practitioner, I should do my best to give the proper knowledge, and that is what I aim to do. And your feedback is always welcome. Thank you for following. Thank you for liking. Thank you for viewing. Please keep doing the same. And if you have any suggestions and feedback, do let me know. And thank you so much. As I will see you on a weekly basis, as we always do. Thank you very much.